Okay, so hi Bradley, how are you doing today?
Hi, I'm alright.
Good. So, I wanted you to come in for a session today, and I'm glad you came because we are going to do a stabilization technique together, which is what I want to use is muscle relaxation technique. Now, let me back up and explain a little bit about what all this means before I dive into you with this. So, I want you to first of all take a really deep breath in and out. Okay. Now, I want you to take a minute and reflect on what do you think is something that is a small trauma or a small T that you've experienced in your life.
Probably financial issues.
Okay. How about something that you have experienced as a large T? So, a large trauma.
Um, I have been in and out of the hospital quite a few times over the past few months with nerve issues in my back. So
Okay.
that sort of
It's,
PTSD from that.
sure. And that is definitely significant trauma. Just being in and out of the hospital alone is significant trauma. So I'm going to do some muscle relaxation techniques with you. Now,
Okay.
typically for sessions, I am really good about just sort of following along with you and doing this with you. But this time, I want to make sure that I'm providing you the best service, and I'm just going to kind of guide you as you go. Just listen to the sound of my voice, just listen to what I'm saying, and we'll get through this. So we've got about 10 minutes, and let's see what we can get through, okay? So, the very first thing I need you to do is I want you to get in a very relaxed position, as relaxed as you can. Maybe you need to uncross your feet, maybe you need to breathe in. Okay, make sure you're nice and comfortable, okay? Now, what I want you to do is I want you to try to straighten your back and imagine that you have a string on the very tip of your forehead or the top of your head, I should say, that's pulling you straight up like a puppet, and you're just as straight as you can. And then I want that string to just kind of cut and slowly sloop back down. This allows your body and your brain to kind of get in position of rest. So, one thing I did want to ask you is sometimes before we really dive into this, we have the option of turning on some Zen music, like some yoga music. Would you like me to go ahead and do that, or would we like to continue in silence?
Probably just continue.
Okay, whatever's more comfortable for you. So now that we are nice and relaxed, I want you to go ahead and close your eyes. I want you to take a really, really deep breath in and out. Wonderful. Now I want you to go ahead and drop your chin down to your chest. I want you to drop your shoulders forward and now up towards your ears and back down. I want you to do it one more time. Let's pull your shoulders up towards your ears and back down. Good. I want you to feel this tension building in and pushing it right back out. Let's do one more time with the shoulders. Shoulders up and out. Good. We're going to do it one more time, and this time I want you to breathe in when your shoulders go up and out when they come back down. And when we breathe out, I want you to say relax. So breathe in, shoulders up, relax. Very good. So now we're going to move on to the face for a little bit. I want you to clench your teeth together as hard as you can without causing any pain. I want you to try to tense the muscles in the back of your jaw. Now turn the corners of your mouth into a tight smile. Wrinkle the bridge of your nose and squeeze your eyes shut, like you were sort of just squeezing it all in all of a sudden. Tense all of your muscles toward the center of your face, almost as if something was pulling your face forward. Now I want you to very slowly release all of that tension back out. Put your mouth back into a comfortable position. Release it all back out. I want you to take a deep breath in and take a deep breath out. Deep breath in. Now we're going to say the word relax as we come out.
Relax.
Good. Now we're going to move on to the forehead a little bit. I want you to raise your eyebrows up and tense the muscles across your forehead and scalp. So just raise them up like you're really, really surprised about something. Feel the tension build, and I want you to hold that tension for a little bit. I'm going to count to 10 for you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and let it all back out into a comfortable position on your face. Very good. We're going to go ahead and move on to your arms and your palms. So I want you to get comfortable, and when you're ready, turn your palms to face down and make a tight fist with each of your hands. I want you to raise and stretch both arms with your fists like this. And I want you to hold as much tension you can in your arms. Squeeze really, really tight and take a deep breath in. And we're going to let it out and let go of our tension. Out. Let's do it one more time. Deep breath in, hold our tension up. Back out. Very good. Let's move on to the back now. I want you to draw your shoulder blades together in the middle of your body like you're stretching your back out. I want you to hold that tension. We're going to hold that tension in for 5 seconds. 1, 2, 3, 4, 5, and now go back into a comfortable position. Let that tension out. We're going to do it one more time, and we're going to inhale as deep as we can and breathe back out. So ready? Go in. Breathe back out. Very good. Now we're going to go ahead and move on to, we're going to move to our hips and to our butt. So tense the muscles in your buttocks by squeezing them inward and upward, like you just sat on something really, really cold. Now I want you to let that tension back out. And we're going to do that a few times while we just breathe in and out, holding the tension in and letting the tension back out. I will count. Well, let's do 5 times. So let's do 1, back out. 2, deep breath, back out. 3, deep breath in, back out. One more time, deep breath, back out. Wonderful. So let's move on to the knees. Straighten your knees and squeeze your legs together. Straighten them best you can. We'll squeeze them together. Let's go ahead and just sort of flex our knees the best we can for just a few minutes. We're going to let out all that tension like we're stretching our legs out. So let's go ahead and count. I'll count to 10 as we release all that tension. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now relax back down. Wonderful. You could put your feet back into a more comfortable position now. Okay. So we're going to do one more thing before we go ahead and wrap it up. I'd like to throw in a little bit of some senses discussion, because I know that sometimes after we do all of this body relaxation, identifying with your senses can be helpful. So I want you to go ahead and close your eyes and keep them closed for the remainder of this exercise. Okay, so close your eyes, and I want you to breathe in deeply and tell me one thing that you can smell.
The wood of the desk.
Okay, good. Now I want you to focus on your hands and maybe your feet and tell me 2 things that you can feel.
Paint spot on my pants and the carpet.
Okay, good. Now I want you to go ahead and open your eyes, and I want you to look around and tell me 3 things that you see.
2 dragon statues, a Joker poster, and a computer.
Okay, good. Now I want you to listen and tell me 4 things that you can hear right now.
The clock, cars outside, the wind, and your stomach just gurgled.
Okay, so now we're going to do the tough one, which is taste. And I chose, let's try to do 5 things that we can taste on our tongue. It might be a little difficult, but maybe think back to what you had to eat today.
Okay. I can taste the buffalo sauce and bacon from the sandwich I had earlier. Um, my breath tastes like Doritos.
We'll do one more.
The air in here tastes a little musty, I guess you could say.
Sure, okay.
Right.
No, that's excellent. That's excellent. Now, okay, let's take one more really, really deep breath in and back out. Now, you've done a wonderful job with me today. I want to just reflect on again, really quick, that we identified 2 of the things that have been a trauma to you, your small t and your large t. And after we've done this exercise, do you feel like maybe it was easy to sort of escape from those t's for a minute and just get away from it all as you were thinking and meditating and breathing?
Yeah, to an extent, yeah.
You sort of feel like it sort of escapes you for a little bit.
A little bit, yeah.
Yeah, okay. There's an awesome word for this. It's called mindfulness. And this is something that maybe for future sessions you and I can work on a little bit more, and we can do other stabilization and mindfulness techniques together.
Okay.
Okay? Thank you.
Mm-hmm.